Okay, so here's a chest x-ray of somebody that probably has congestive heart failure. And just like when you're learning to read EKGs and getting the sense of what a right bundle and a left bundle branch looks like over which part of the QRS complex is peaked, you have to get a bit of a gestalt over time of reading x-rays without knowing what's wrong with the patient and getting an idea of what's wrong with them before someone tells you. So this x-ray would be somebody that I would expect probably has some congestive heart failure, and I'll try to tell you why. Again, from the standpoint of the technique, the film is a little rotated to the right, but the trachea overall is midline. The bony structures look okay. The tech almost nipped this corner, but barely got it. The lung volumes are pretty normal. The lungs are well expanded. But what your brain draws you to, of course, is what's obviously abnormal, and that's how big the heart is. Now, keep in mind, of course, that with portable x-rays, the heart is the closest to the film, other than the sternum in the anterior part of the person's body. So the heart is always going to look a little bigger on a portable film, but this clearly is going from more than the midline all the way to the edge. So this is definitely an enlarged heart, mostly left ventricular just by the contour here. There's no obvious pleural effusions because you can see the angles, though that's a bit fuzzy. This one's sharp, so if this person has pleural effusions, they're small, less than 500 milliliters probably. But then the next thing that will capture your eye is just how sort of generous and juicy these vasculature appear to be. So the pulmonary artery on the right is here. The left is buried underneath the enlarged heart. The aortic knob is up here. And then all of this just looks generous. I'm not sure that I could tell that this person has curly B lines. I don't see them all the way to the edge. Maybe on the real film you might be able to see them. But if I saw this film, I would say this person is probably volume overloaded at the least, and based on this big heart, probably has some congestive heart failure. The right side of the heart, the border is here. There's not any obvious infiltrate or atelectasis because you still have your preserved airspace between the pulmonary artery and the right atrium there. The other thing you can sometimes get a hint on how big someone's heart is whether the carina is splayed. So keep in mind, of course, that the trachea comes down and divides at the main carina here. The left main stem bronchus is here. The right is here. The right upper lobe takeoff is seen there. The bronchus intermedius is here. And so this angle of how the carina divides there is actually pretty normal. It's probably about 90 degrees there, and that would be the upper limits of normal. But when you start seeing the main stem bronchi splayed out, that gives you a good hint that maybe the left atrium is huge or that there is a mediastinal mass underneath. But this would be somebody I would think probably has some congestive heart failure.